I'm Emily Holzhausen, I'm Director of Policy at Actuarial UK.
And could you give us a kind of a brief review of what it was that you were talking about, so important to you about this debate about the social and economic costs of dementia?
Well, really, I was looking in particular about the people that we represent as an organisation, so families, people like you and I, who are caring for people that we love and care about, parents, brothers, sisters, people within our family who might get dementia, and really looking at the personal, the economic and health costs that those individuals have to face, sometimes as a result of caring for somebody with dementia, and they can really be very significant.
And there's very much, as you said, the unsaid costs. When you look at the costs of dementia for the people suffering, yes. And we talk about the health and the social costs, but you mentioned about the cost for the people caring, for example, pensions, potential pensions costs for people who wouldn't want to be in work. I mean, where do you see this?
Well, there are the work costs, and what we're seeing is that really as we are extending working lives, more and more people are juggling work with care, and in the next 20 years, as we see a rise with people with dementia, it's increasingly likely that we're going to see people squeezed between the difficult choice: how on earth do I juggle work and care, keep my income, keep contributing to my pension and all my other costs, and yet care for this person whom I love? And we urgently need to find a solution for that. It's already hitting millions of people now as we speak. 1 in 5 people gives up work to care, and many of them end up in lasting poverty throughout the rest of their lives. So those are enormous costs. And then there are health costs as well with families, and you find that's particularly acute with dementia, just because of the strain, the worry, interrupted sleep. And we need to pay much more attention to how carers' health really is better supported with the system.
And you mentioned then though, I suppose, mental health, the kind of, you talk about stress, but the impact for the individuals who are involved in this. And again, it's kind of across the different areas. So you've got where the NHS is involved and where social care is involved. Where do you think the support for carers can come in?
Well, it's quite complicated, because quite often people say, what is the thing that carers want? Quite often carers will say, a break. What they really mean is, I need you to sort all these different things out. I just need time off from all these complications, because a carer will often be dealing with maybe 1, 2 or 3 different consultants at the hospital, the GP, the practice nurse, the pharmacy, different drug regimes, and then there's the local authority, the council tax department, possibly housing benefit, maybe other different aids and adaptations locally, the benefits department. It just goes on, and can you imagine the number of appointments, the number of forms, the complications? If something goes wrong, then you need appeals, then you need to query it. If you can't get hold of somebody, something is cancelled, you need to rebook. Just that administration is extraordinary, and that is, anybody finds that stressful, and that is when you don't, we get professionals who are trained to use systems like this. We have some very, very knowledgeable advisors, for example, help you navigate through the system, but if you happen to do it alone, it's incredibly stressful. This matters.
So what would be your recommendation, looking at carers, and specifically in this environment, we're talking about dementia, but it's similar. What would be your recommendation going forward from this debate, looking at the costs and what we can do?
What I think is to really understand the impact that dementia has, not just on that individual who has that diagnosis, but to look at it in the round and to see it more as an issue for our economy, really, in the round. To not see family as perhaps a cheap option, because it's not. And anyone who has experience of dementia where your family member's not well supported, you can see those costs, and they last for years, and emotionally too. And that's not how we want our relatives to end our lives. We live in a civil and civilised society, and we aspire to better than that. So in the short term, it's incredibly important that we look at finding the best solutions that we can. We need all the government institutions to take on caring and disability as an issue, and to look to make our public services as best we can. And we need a very good funding settlement that is fair and sustainable for the future for social care.